Thank you everybody for joining. Sorry I'm a little late. My name is Elliot Hu. I'm the chair of the Practice and Policy Committee. So this is the members webinar that we hold on a quarterly basis. And so today's theme is going to be community advocacy. Before we start, we do have some leadership from the committee here as well. I would like to give them a couple of minutes just to go over really quickly any updates on their projects and any calls for volunteers. And then we'll get into our community advocacy webinar where we have our speakers today talking a little bit about their community advocacy project. So go ahead, let's see, first on my list, at least the first picture that's showing up is Brooke. Brooke, you're muted. Brooke, you are muted. Let me see if I can unmute you. Oh, there you go.
Now? Yep. Sorry about that. I'm on my phone here. Nice to see everyone. For the Innovation Subcommittee, we have had some amazing volunteers working on a couple of issue briefs. So we're hoping to review those in the February meeting and then be able to get those out before the annual meeting, which would be great. The high school team position toolkit edits went out in December. And so again, we'll talk about that at the February meeting, just in case anyone has anything to add. Still looking for potentially a sample medical services agreement to de-identify and include as an example. So following some leads there to see if we could get one of those. And then hopefully, again, in the works is the ongoing conversation about title protection. So we'll keep you posted from that standpoint.
All right, thank you. All right, let's see who else is up. Sarah, you are up on the next on my list.
From awesome. Hey everyone, Sarah Kinsella, Legislative Subcommittee Chair. Main updates, I think a lot of state legislatures will be meeting soon. Brian sent us a great update in the last advocacy corner. So if you're looking to get involved at the state level, make sure you review the handbook, take a look at the map to see any legislation that's being introduced in your state. There was a number of state days being organized, I believe, by the AMA for the Smart Heart Coalition initiatives. So that was all in the last advocacy corner. So that's the best way to get involved at the state level.
Right,
that's my main update.
Wonderful. Thank you. All right. Who's next here? So I got an email from Katie Fairgrieve Apple that she's not going to be able to make it, but Brooke gave that update. And I haven't gotten any more emails. Oh wait, I just got Tony's. So Tony's not going to be able to make it, but I think Alex can update for him as well. So Alex, you're up. You're next on my picture list here.
All right. Hi everyone. I'm Alex. I'm the fellow liaison to the committee. So we have a few updates on my side. We're working on a paper about musculoskeletal ultrasound billing. It was spun out of a white paper, and actually we're in the revisions process. Elliot and Tony have been a big part of that. We also recently received some feedback from a journal that we submitted to around balancing non-clinical and liability obligations for the clinician or the physician. That spun out of white paper as well. And then we finished, I think in the past few weeks, the white paper on the value of primary care sports medicine, which is ready for posting on the new website. And then there's work ongoing around an immunization issue brief, which we finally have a first draft together. And then I've been working with Ed Smith on the sports economics series. We're trying to make like a financial webinar mini series, and that progress is in motion.
Sounds good. Thank you, Alex. So just to add a little bit as well, I just found this out today too, but we are looking at potential avenues to getting physician compensation data from AAMC-MGMA. We started those conversations as well. We got some preliminary numbers back. I can't commit to anything and I can't promise anything, but what I can do is I can promise that we will look at those numbers to see if there's anything that is financially responsible and fiscally responsible for everybody. So there is that effort going on within the practice and economics subcommittee as well. So last but not least, Michael, do you have anything to update before I give Luis's and then Neha's updates?
No, just to reiterate that we're working on the white paper for contract pitfalls. We're also working on with Cindy and Kathy on the ICL for the AMSSM meeting on malpractice, and Brian has been in touch with our orthopedic colleagues, staying in touch with their government affairs committee on all the ongoings as far as malpractice and the latest from the professional team society. That's all I got.
Great. Sounds good. Yeah, so Michael, thank you so much, and Brian for representing us as well. So there is an ICL that we're presenting this upcoming annual meeting. We have a publication, an editorial publication coming out in February in Current Sports Medicine Reports on this as well. And then Brooke has updated the high school team physician toolkit to include some of the stuff in there too, which we will discuss in our next community leadership meeting to how to formalize those updates as well. Now, I do want to before I get on to the other updates, I do want to encourage everybody for the 2027 annual meeting. They are calling for proposals, so it's a little bit different. Historically, the program planning committee kind of looked historically and said, well, these are things that maybe the members would like or gotten membership feedback and said, well, these are the topics for the annual meeting. But if you have any ideas that you would like to present, or you could nominate other people to present, or just ideas in general, you can submit a proposal as well. Please submit it to Brett Torsdahl. I know that a couple of email blasts came out, and please email that to him. I think the deadline is March 2nd. We are submitting a proposal for professional liability, which includes NIL. And so Steven Stacha, who at Rothman has taken a big lead on this, who has done some research projects on this as well. He's the one who brought it up to me, and I co-submitted it with him as well. So we're all working together on this. If you think that, yeah, run it by me, run it by Michael, run it by anybody as well. If you have ideas, I'm happy to work with anybody and everybody on projects and also topics that you think would be great for the membership. So without further ado, we're going to go, let's see, Luis is in charge of he's the subcommittee chair for healthcare transformations and quality measures. And so a couple of major things that he has going on is that we've been in touch with ABFM in terms of establishing a sports medicine QI project, part for maintenance of certification. So he's still working on that. Sorry, my light went off. But he's been working on that. Stay tuned for that. He's also, we are also expanding and continuing the Choosing Wisely campaigns called the Playbook. And so he might be looking for writers for that. Neha had to be traveling today as well. She's the subcommittee chair for community advocacy. And so the Community Advocacy Award, the applications are opening. And so it's going to be open for about 3.5 to 4 weeks or so. And so if you're interested, or if you know other people who have interesting projects or very meaningful and worthy projects, please encourage them to apply for this Community Advocacy Award too. So that's all I got in terms of updates. And so without further ado, I don't see Jeremy Close. I don't see Ben on here. I don't see Calvin unless they're here. If they're here, please let me know. But I do see Amy Valasek here. So we have our either the former winners or Community Advocacy Award applicants from past several years here to talk about their community advocacy project because this is the community advocacy theme. The whole idea is to see and what their community projects are, how they got started, what's on their mind, why did they kind of start it in the first place, and how is it going? hopefully this would inspire and encourage a lot of people to start their own projects and possibly even submit for the Community Advocacy Award. So without further ado, Amy, since you're the only one here that I see on the list of speakers, unless Jeremy Close or Ben or Calvin are here, you're the only one on my list. So without further ado, if you can introduce yourself, introduce what your community advocacy project was, and if it's still going on, and then we'll have a back and forth on this, and hopefully other people will join in.
Yeah, sure. Thanks for having me. So my name is Amy Valasek. I'm a pediatric sports medicine provider at Nationwide Children's in Columbus, Ohio, and recently was elected to the board of AMSSM and head up with Tina Masters, co-chair of research for AMSSM. I got involved with community advocacy kind of organically. I think as a pediatrician, you're inherently involved in advocacy if you're going to take care of children. So I think deep down it was always part of myself how I identified as a physician. But when I took the job in Columbus 12 years ago, the building that I work out of is a joint venture from Ohio State, Nationwide Children's, the community. And so essentially it's a medical center, a fitness center, a community center, all in one. And that's where I see patients out of. So kind of like a forward-thinking, progressive opportunity is what led me to Columbus. And in this center, there's a gym, there's physical therapy, there's massage, there's acupuncture, and then there's like community space for people within the community to exercise or have lectures or demos for nutrition and cooking. And health and wellness was like a big thing with this building and joint venture being built. And so also out of the building, Ohio State started Exercises Medicine, the adult version for ages 21 and up. And with that, and with my skills and just interests, I kind of put out any kind of opportunities they needed help with launching Exercises Medicine out of our building. And with that kind of programming, it just kind of one thing organically led to another, where I was asked to coach fitness classes. And long story short, I never ever in a million years pictured doing any kind of group fitness. I like working out, do it on my own, but that wasn't part of it. And I was invited to come to a certification session. And this was about 8 years ago or so. And I went on a whim, loved it. And while I was there, what I didn't realize is the majority of the people that were teaching classes out of the center were physical therapists, were also nutritionists or a physician assistant or nurses. And then they were kind of teaching these exercise classes kind of on the side. And from that point forward, I haven't looked back. I think I have 6 certifications now or so in different exercise formats. I teach weekly, sometimes 3 classes, typically around 5. I do them early morning, so I'm teaching a yoga class early morning before work tomorrow. And I think when I look back or think back, this was a very organic thing, but in the end, it blended 2 things. Definitely my passion for musculoskeletal medicine and exercises medicine and advocacy. And so with that being said, what I didn't plan on is it grew really quickly. I was being asked to like run a fitness class for some of the high school students, or for certain teams would want to come. Girls weightlifting, there's not a lot of I don't know, situations that maybe young girls, adolescent girls feel comfortable. So there's a weightlifting class I teach, and I was asked a lot to teach certain subgroups of populations, and it grew into me partnering with Buddy Up. And this is kind of new in the last year and a half. Buddy Up is a national organization. It actually started out of Columbus, Ohio, for kids with Down syndrome. And so they had heard what I was doing, and they really wanted to add some cardio for their kids and athletes with Downs. And I've been teaching them for the last year and a half on Wednesdays after school. Their favorite format is boxing, kickboxing. And the two things that this cohort had asked for was rap and a lot of punching. And I was like, I got you covered. And so it's been such a joy. Fast forward, just seeing how this can grow. And I think it's really taught me to think outside of the box and outside of the office. Ironically, I see patients in the same building of where I'm doing this, but I've met so many people and so many instructors, both in Columbus, nationwide, and then across the continent. Now have a lot of colleagues doing the same thing in New Zealand, for example. And it's just really, really grown. I think the thing I'm most proud of is how far of a reach it has, and it's definitely taught me it's limitless. And I would say my most favorite population to teach are our adolescent kids and the adaptive athletes at Buddy Up. It's really awesome. And I'll just stop there.
Yeah, no, that was great. Thank you. Fortunately or unfortunately for you, Amy, you're the only speaker who's here. I didn't see anybody else join, but therefore you get to dominate the conversation with your project. So a couple of questions for you though. You said that this project was expanding. Are you still the only one teaching, or have others gotten involved?
So I think as a physician, the only one. I think others, there's different nurses, PAs, other healthcare providers, nutritionists that also teach too.
Yeah, so the reason I ask is that, oftentimes these projects, you're the one who started it, you're the one who continues it, and then if you don't want to do it anymore, then it ends. And so, tough question for you. I know you can't see the future, but if you can give us your answer on this, how do you foresee continuing your project? Let's say if your plate gets full, how do you foresee continuing these projects in the near future or in the far future? If let's say if ever you don't have enough time for it, or you just don't have the capacity for it anymore.
That's always a tough question. I think I try to live in the moment and not think too much down the road. I think, truthfully, Elliot, and to the group, like this is like an outside passion of mine that's just kind of grown and blended in. I really hope that it gives people food for thought of where you can fit things in to make a difference. If the project just kind of stopped, I know I've trained others to be able to teach, like during this, like I help now with certifications. So if it's not another physician, it's another healthcare provider that's doing it. And so I do think it will still carry on no matter what. It might not be a sports medicine physician provider doing it though.
Yeah, so I think, you and I sharing similar experiences with this that, even during medical school, I was very passionate about community service and community advocacy too. But the struggle that I had was, well, I would start a project or I would take on a project that was started by somebody else. And then I ran out of time or I had too many things on my plate. And then it kind of just dropped after I was done with it. But what I realized is that there are learners, there are other future generations that can kind of take the torch from you. And so we do a lot of mentoring. And I think that is a big part of this. If you are able to mentor people with similar interests, then they can potentially take it over for you as well. Or if you find a group of them, that's even better as well. So thank you for that.
Yeah, sure.
Now, my next question for you is, what what challenges did you find in terms of, or did you encounter while starting this project?
I think the typical challenges that we always face as physicians, time and protected time. And so time, what I learned quickly is it needed to be outside of clinical hours. So I had to really think thoughtfully with my family, work-life balance. Where in the world was I going to fit it in? So naturally, I said 5:30 in the morning, and in the end, that's what I do for most of them. But at the end of the day, that's usually when I work out anyway. So it really isn't much. And then these extra things that I was asked to do, the different teams or different populations, that it gets hard. Like I truly have to sit down and figure out, is there someone else I could suggest? Or maybe a couple times I've split the 8-week program with another co teacher to kind of figure out, like, I can't commit to every Wednesday for the next 12 weeks, but I could probably do 8 of them. So plus my own kids and family. So it's quite a balance, but I would say I wish we had more protected time as physicians to fit things in like that. Because it really does make a difference. I mean, for instance, in the last year, just to give you all an idea, I taught over 2,500 people. I mean, and that's a lot of people. I mean, I see a lot of patients too, but I think I make a bigger impact doing this than sometimes the day-to-day typical in-clinic impact that we make. So I think protected time has been difficult, but I've made it work.
Yeah, I think you hit the nail on the head on this. You know, time is always valuable for everybody, and we don't have enough time to do everything that we want. But you bring up a good point, or you bring up an interesting point. At 5:30 in the morning, how many attendees actually attend with you?
All of them. It's always full. That's the thing. And it's not me. I think people really need this. There's always a wait list. So my classes are 20. And that's really, the room only holds like 15. So we're all kind of packed in. But
yeah, no, that shows the passion of you and also the passion of your attendees as well. So I think, you know, if for future community advocacy projects, if we're able to find something that we're passionate about and the community is passionate about, people will make time for this.
Yeah.
Whether you know it's they're busy or not, they're going to make time for it. And you know, I think 5:30 in the morning is a testament of that. Now, a couple of follow-up questions for you as well, Amy. How supportive is your organization in giving you protected time or supporting your project on this?
I think they're super supportive. I think protected time is not part of the equation and hasn't been. But it was one of those I had to sit down and figure out what was important to me, and I'm fine with it because I mean it really has expanded, and it was worth taking that leap despite not having the protected time.
Yeah, I think you know the whole point of that question was that you know yes they are supportive, but they're only supportive up to a certain extent, and so we take all the support that we can get. But sometimes you just have to work around it. Now, there might be other things that you can spin off to the organization in terms of injury prevention or in terms of general health and healthcare prevention and you know preventing chronic diseases as well. But certainly we do have to spin it like that in order to get more organizational support. So final question for you before I'll open it up to Q&A for you, Amy. Now, do you have any other future community advocacy projects in mind or passions? And what advice would you give to those who are interested in starting their own project, if it's one thing that you can tell them?
I think the one thing is find the population you enjoy most working with and just keep at it. And so for me, I really truly enjoy the value of exercise in day-to-day life and health and wellness. I know I physically feel better when I sweat and do something. And it's really interesting to be up front in front of 20 people who, you know, it's early, we're tired, everybody's got places to go and things to do for the rest of the day. But no doubt, everyone feels better. They feel ready to tackle the day ahead, or that mood that they came in with that maybe wasn't in the greatest headspace. They're leaving a little clearer. And so I think finding that population where you feel like you can make a difference, I think in summary, the only reason why I keep doing it is because I know it makes a difference. And at the end of the day, I think that's what matters the most. I see it.
Yeah, so that's great advice to everybody. I think, passion, you have to be passionate in terms of what you're doing. Otherwise, you're just kind of doing it for the sake of doing it. And I agree with that. I think, it embodies what we do. We're all passionate about sports medicine, injury prevention, whatever aspect of sports medicine or conglomerate it is. We don't go into sports medicine saying, well, I'm just doing it. We all have a passion in this, and certainly in your community advocacy projects too. So Ashley Acheta had a question. I think Brian answered as well. Her question was, is this community advocacy award for residents? Is it for everybody? Is there only one award? So it is for the entire membership. I think Brian answered it already as well. I don't see your, oh, there it is. So eligibility criteria, Brian put in there, applicants must be AMSSM members. And so the award recognizes community advocacy award efforts that enhance the health and safety of local populations. But the advocacy work must be current and must be completed within the last 3 years. And then selection is based off of the strength of the application and demonstrated impact of the advocacy work. So there is only one award that's given per year, but it doesn't mean that you can't apply for it even if you didn't get it. And so I would encourage all those who applied in the past, if your community advocacy project is still going on, it meets the eligibility criteria, but for whatever reason you didn't get selected this year, I would encourage you to apply for it again. And so, we would always love to see more community advocacy efforts out there. And I think this encourages these efforts as well. So thank you, Amy, for giving this wonderful talk. I'd like to open it up for more questions if there's any. I'll give it a couple minutes here. If anybody wants to unmute themselves and ask, or if they want to type it in the chat, I'll take a look. But other than that, yeah.
I have a question. When will the new fellow liaison applications open up for the next academic year?
Yeah, so to answer your question, first, the fellowship class representative has to be chosen. And usually that, I believe the application for that or nominations for it in the selection is usually around February. And then once that is completed, then the fellowship liaison applications and nominations will come out as well. Alex, do you remember when you applied last year or not?
I thought I applied in February, and I thought it was around the same time as the I thought the class representative was part of that application, but I could be mistaken. I'm not 100% confident.
Yeah, I think it may open up around the same time, but usually I think how it works is we select the class representative first, and then the fellowship class or the fellowship liaisons, fellow liaisons will get selected after that. I'm not exactly sure. Brian, do you know?
Yeah, that's about right. I don't have the exact dates. Maria, we can get you the exact dates.
Okay, thank you.
All right. I am checking the chat. It doesn't look like there are any more questions. Does anybody else have any questions on the call right now? Okay, so if nobody has any other questions, thank you again, Amy, for giving this talk on your community advocacy project. I personally would love to hear more about it the next time that we see each other again. I want to see I want to hear about the progress and everything too. I'm always interested in this stuff as well. I would encourage everybody to nominate, to spread the news about the Community Advocacy Award. It's a great way to get the news out. It's a great way to get rewarded. It's also a great way to get a little bit of funding for your project too. So thank you everybody for attending. And if you have any issues, you can always email me. You can always email Brian or practicepolicy@amsssm.org. Thank you for attending, everybody. And then our next meeting for community leadership will be in February. But I think we do have another quarterly one coming up for all members. I believe it's in July. Am I correct, Brian?
Yeah, we'll have April. Don't forget April in
that's
Seattle.
right, that's
We'll
right,
see
April.
everybody in Seattle, and then after that, yeah, July.
Yep. All right. Thank you, everybody, for attending. Have a good night, everybody.